This course focuses on enhancing the therapist's understanding of anatomy and functions of the four rotator cuff muscles, the supraspinatus, the infraspinatus, teres minor, and subscapularis, as well as how they contribute to shoulder mobility and stability. Participants will learn assessment techniques to identify muscular imbalances and restrictions, as well as common injury patterns such as impingements or tendinitis. The course also aims to refine palpation skills and provide targeted massage protocols to reduce pain, increase range of motion, and support recovery and rehabilitation. Emphasis will be placed on integrating massage techniques such as myofascial release, trigger point therapy, and deep tissue work with client education, as well as post-treatment recommendations. By the end of this course, participants will be able to design and deliver customized treatment plans for clients experiencing rotator cuff issues, improving therapeutic outcomes and expanding their scope of practice.